here with Eric Westman, who's a medical doctor and the president-elect of the American Society of Bariatric Physicians. And you're like perhaps the world's #1 expert on low carbohydrate diets.
Well,
or at least one of the top people, right?
Okay.
Why? How did you become interested in that?
Well, at Duke University, we started a lot of the low carbohydrate science that's been done in the last 10 to 15 years. And a lot of other people now have done that science. So, I mean, I kind of sheepishly, I don't want to take the honor of being the world's expert because other doctors have known about this a long time. All I did is really help formalize the information and, well, then bring it up to a scientific level of credibility. So the knowledge has been there a lot. In fact, we're at the meeting here in Las Vegas, the American Society of Bariatric Physicians, and a lot of doctors here use low carbohydrate diets in their practice.
Yeah, I was a bit amazed actually during this conference that speaker after speaker was mentioning that low carb is the best way to eat if you got obesity. And if you go to other conferences, even other conferences on obesity, that's not the case. It's not even mentioned. Right. So how come there is such a big difference, so much more knowledge perhaps here about low carbohydrate diets?
Yeah, well, of course it's complicated. I think right now there's a knowledge transfer deficit where the randomized trials that have been done, the new evidence has not been really heard or listened to or been in front of all of these other organizations. And that'll happen with time.
So lots of big trials showing significantly more weight loss with the low carb diet for obese people.
Well, just about every prediction about low carb diets has been found to be incorrect. For example, people predicted you couldn't lose weight by low carb diet because you didn't talk about calories. Well, you don't have to talk about calories. Right. You can talk about carbs, and people limit their caloric intake by eating less. You know, they predicted that the cholesterol would get worse, when in fact the good cholesterol goes up more on a low carb diet,
which is good.
Which is a good thing. Yeah. Right. So the science is pretty solid that low carbohydrate diets are healthy, not only for obesity but for just health in general.
So the science is beginning to catch up in the last decade or so, with big trials showing this, but you've been doing it for even longer, like 15 years almost, with how many patients now?
Right.
How many?
Well, you know, we started with 50 patients, then 200 patients in studies, and now I have a clinical practice at Duke University where I have thousands of patients.
Thousands?
Yeah. Now, I don't collect the information at the same level of detail as the research.
No, but you see them all.
Well, that's right.
So what's your general impression of how's it working for them?
Well, it works really well.
Yeah.
Actually,
knew you'd say that.
Teaching a low carbohydrate diet is really easy, and for those people who follow it, it works really well. Now, not everyone follows it, and not everyone has great success, and that's really where the research should focus, is how to make it even better, more sustainable, instead of ignoring the fact that it works.
So, I mean, you've been doing it for a long time now. What is the biggest problems for people doing low carb? What's the most common mistakes or difficulties for people in following it?
I think it's a paradigm shift idea, so that if you carry over the idea that fat in the diet is bad for you into the low carbohydrate world or low carbohydrate eating, it's not as satisfying, it's not as delicious, so it's harder to sustain over time.
So you can't do low carb and low fat at the same time?
Exactly. Don't do low carb, low fat. That is not how the low carb doctors who knew all about this for the last 150 years practiced it. And actually, so the fear of fat is the dietary fat, I think, is the root cause for so many people being told that the diet is bad, that you're going to kill yourself, and it's wrong. I mean, we were taught the wrong thing, and when I say we, it's the whole U.S. population. It's the doctors, the nurses, the dietitians.
Yeah, so everybody's been believing in the fat is bad theory. Even me once.
But that'll change. You know, remember the story of how it was figured out that the Earth went around the sun instead of the sun going around the Earth.
Yeah.
Yeah, I mean, it's a fabulous story, and it's really brilliant how they figured it out. And I mean, so you imagine, you know, the sun goes around the Earth, right?
Yeah.
Look out the window.
Yeah,
right?
it's obvious. Like eating fat makes you fat.
Right.
It's
so
obvious.
It's obvious. Well, but wait a minute. The sun doesn't go around the Earth.
No.
The Earth goes around the sun.
Oops.
Are you crazy?
Yeah.
So it's just now that teaching is happening, but the fear of fat, the feeling that you're harming yourself by eating fat is so strong that it affects the psychology of it, and so that's really something that has to change.
Yeah. So in your practice, I'm sure you discuss patients with other physicians from time to time.
Yes.
What kind of what do they think about you treating patients with strict low carb diets, high fat diets?
Well, I have to say it's changed since over the last several years.
Yeah.
The first round of the low carb studies that came out around 2004, there was enormous pushback from doctors and media and all that. And now the persistent low carb science has been there, and with the new Atkins book that came out last year, and in the US has sold about 500,000 copies already.
That's pretty good. And you're
It's
one
fantastic.
of the authors.
Well, I'm one of the authors on the book, that's right.
New Atkins for a New You, it's called. It's a good book.
Well, there's been no scientific pushback and no medical pushback that I'm aware of, and I assume I would get the heat, so to speak. So in my own practice, other doctors are convinced when we share patients.
Right.
But so
So
the science doesn't seem to matter.
They believe what they see, huh?
So they believe, well, but then you get into the problem of the sun going around the Earth. So you have to combine the research knowledge, the theories, and the practical observation. And I mean, it brings up a recent case I had of a gentleman who has heart disease. He has coronary disease, documented 8 years ago on a heart test, looking at the arteries.
Yeah.
He started a low carbohydrate diet 4 years ago in my clinic, and he did really well, had no chest pain. Now he had chest pain recently, which is a possible sign of the heart problem coming back.
Right, yeah.
He went
And
to the
that can happen,
hospital.
that's common, right?
He went to the hospital, had another test to look at the arteries, and in fact the doctors were predicting that, oh, you're doing that diet with all that fat, we know it's going to be worse. You know, I'm sorry to say, you know, we can predict it's going to be worse. He had the test done, no change in the heart disease, the coronary artery blockage for 8 years. And well, now it doesn't say that the diet doesn't fixes it, or I mean, it's one case.
Yeah,
but
it's only one
it
case.
just shows
but
that if everyone's going to get heart disease from the diet, well, that's not true, right? And that's the current belief, is that everyone's going to
we
get
have
heart disease.
the Shai study, 2-year Israeli study on low carb diets, where people got the advice to eat low carb for 2 years,
Right.
and they checked their coronary arteries, their carotid arteries with the ultrasound before and after, and it actually decreased the amount of plaque in the arteries.
Yeah, that was
which is
a landmark study.
It's like the first and only one to test that, I guess.
Yes, with
the
low
low
carb,
with a very low
arm.
carb diet.
Yeah,
So the first and only one actually showed an improvement.
right.
That's pretty big.
That's fantastic. And yet nobody really talks about it much. I have a colleague who says we publish the low carb studies and then everyone ignores them. That's another strange phenomenon.
But not everybody, because going back to this meeting now for the American Society of Bariatric Physicians, these are doctors who treat obese patients all the time, right?
Right.
Every day.
Every day.
Yeah. And most of them seem to be into low carb.
Yeah. I think we did a survey a couple of years ago of the membership of the ASBP, and I almost a half of the doctors use some form of carbohydrate.
Yeah, and that's a few years ago, you say.
Yeah.
I would guess it's more now.
Changing, yeah.
Because I've been walking around talking to people, and they all seem to be, I mean, not everybody, but like 90%.
Yeah. Well, the main teachers here at ASBP over the last several years have been using low carbohydrate diets. Mary Vernon in Kansas, Alan Rader in Boise, Idaho. They all use some form of carbohydrate restriction. Yeah.
Well, I think it's very interesting. Maybe this is like a sign of things to come.
Well, I hope so. Yeah, you know, it even though again another obesity is causes billions of dollars of expenditures for this country. And 1 in 3 adults are obese. 1 in 6 children are obese. So when the country really wants to fix it, these are the doctors to ask how to do it.
Right. And it's interesting that the people, the doctors who actually treat obese patients all the time using dietary means, for example, they're mostly into low carb.
Yes.
But when you go to other meetings where people are only talking about, research, surgery, drugs, they maybe don't really know much about this.
Well, the paradigm view that fat is bad in the diet has blocked the research funding into the higher fat diets. So if you talk to researchers who are funded in the current paradigm, they're not going to know about it. And there's so much information today that most researchers can't keep up with other people's research. Well, so we need things like meta-analyses and people reading the science and synthesizing it, and that's what happens at this kind of meeting.
Yeah, but there is quite a lot of studies on low carb now.
Oh yeah, absolutely.
And you've been part of a lot of them.
Yes.
Quite a few of them anyway, showing that diabetic patients, for example, can improve their disease and lose weight.
Yes. Yeah. That to me it was a no-brainer.
Yeah, we know it's true, right? But it's nice to have a study showing it.
It's nice to have a study showing.
Well, there are a few, but I think yours is perhaps the biggest and best. Is it?
Well, yeah, and even then it's relatively small when you look at drug studies that have tens of thousands of people.
Yeah,
so
it's tiny compared to
having
that.
100 people.
But you've been doing studies looking at other kind of diseases too.
Oh, sure.
Like what?
Well, the pilot studies we've done using low carbohydrate diets include polycystic ovary syndrome,
the difficulty conceiving children for women.
Right, so polycystic ovary syndrome is a major cause of infertility.
Right,
for
and
women.
what did your pilot study show?
Well, when we put 5 women with PCOS or polycystic ovary syndrome on the diet, they lost weight, and actually 2 of the women became pregnant. So
and they couldn't become pregnant before.
Right.
So that's pretty good, 40%.
That's fantastic.
Tiny study, but still. I'm sure they thought that it worked quite well for them.
They were quite happy. Fatty liver. There's this also the fat in the food, fat on the body mistake. Fat in the liver actually comes from carbohydrate in the food. So with liver biopsy proof, we put again about 5 people on the diet over 6 months, and fatty liver went away. And that study actually had pieces of liver examined under the microscope to prove that. So, irritable bowel syndrome goes away.
Also a huge problem, right?
It is. Yeah. GERD, heartburn, reflux, or heartburn symptoms go away in about 3 days for most people.
But is that for all people or for most people?
Well, in my clinical experience, it's almost uniform across the board.
So I meet some people who feel that they get more problems starting well, they feel that eating a high-fat diet gives them more problem with heartburn.
Really?
Few anyway, few. I don't think it's the majority. I think it's just a minority, but still.
Okay.
You don't see that?
No, and heartburn medications are one of the first ones I get to take away from people because they don't need them. That would be a great question for a survey of the low-carb internet groups that are out there.
Yeah, I did that actually once a few years ago, and I got mixed results, but most people were improved. Do you see any problems with low carb, like people becoming ill in some way?
Well, you know, the low carb diet has thought to be a treatment for obesity, you know, a weight loss diet, and using it for that, it's very effective, very healthy, and counter to what people have been taught. But so I really teach the diet as a lifestyle for anyone, not just as a weight loss kind of program. And I mean, there are some people who have hereditary tendencies toward gout or kidney stones, and those people need to be put on medication regardless of whether they're on this diet or other diets. So I think those are the areas for research in the future to fine-tune the type of diet.
Sure. But it's been nice to be here at this meeting, you know, seeing the paradigm shift at work, right? Don't you think it's happening?
It's fascinating. It is happening. And I think a lot of the work that's been done in Sweden has been very helpful. And so I hope you can continue that.
Sure, of course. Thanks very much.
My pleasure.